Good afternoon and welcome to a special Webinar Wednesday Roundtable presentation. We're excited to have over 280 registered attendees for today's webinar, which is eligible for 1 credit from the ACI. Let's get started by giving one lucky attendee a Webinar Wednesday lunch bag for answering this trivia question. Which actor plays Buddy in the Christmas movie Elf? Answer now using the questions feature on your dashboard. While you're answering, I want to invite everyone to join us for our annual Imaging Conference and Expo, which will be held February the 17th to 19th, 2019 at the Wyndham Grand Resort, Clearwater, Florida. The ICE conference will bring imaging service professionals from across the nation for 3 days of learning, networking, and the latest advances in imaging. Registration is now open, and details can be found at attendice.com. Okay, and the winner of our Webinar Wednesday lunch bag is Todd Forsch. Hope I've said it correctly, Todd. Congratulations, and the correct answer is Will Ferrell. Webinar Wednesday would like to thank our sponsors, Centrak, ZulaFly, Infinite Leap, and Sonitor. Our panelists today are Steve Bollinger, Vice President, North American Sales at Centrak, Stephanie Andersen, CEO at ZulaFly, Mark Rheault, Founder and CEO at Infinite Leap, and Sandra Rasmussen, Senior Vice President, Global Marketing and North American Sales at Sonitor. Steve, you may begin whenever you're ready.
Thank you very much. Hi, everybody. Great to be here this afternoon. My name is Steve Bollinger, and I am the Senior Vice President of Sales for Centrak. I come to this webinar with almost 40 years of experience in and around the healthcare space. Actually, that sounded a lot better to me in my head than it does saying it out loud. Leave it to say I've been in and around the space from a clinical point of view as a radiologic technologist, crossing over to the dark side into sales and sales management in my late 20s and never looking back. I've been in the RTLS space for the past several years now, and I'm very happy to spend a little bit of time to educate you as to the role that Centrak is playing in this marketplace, and it's a very exciting space to be in right now. Suffice it to say, I think that we could be considered one of the leaders in the industry, as well as a thought leader, along with my esteemed colleagues on the panel here, some of whom are close partners of ours as well. But we're installed in over 1,000 hospitals worldwide, over 4 million devices in use. We have been rated #1 in class for the last 2 years in a row. We're deployed in over 50% of Best Becker's Hospital Review Top 100 facilities. And at one point, we were awarded Deloitte & Touche Tech Fast 500 3 years in a row, but we're actually no longer a Fast 500 company because of our acquisition a couple of years ago by Halma PLC. So we are a wholly owned subsidiary of Halma, who is an aggregator of healthcare and security companies. They have a market cap of $6.6 billion, so we are a very stable company. We are one of the top companies in their universe of healthcare companies that they've purchased over the last couple of years. Their stated mission is protecting life and improving quality, which fits very well with Centrak's mission as well. So you might ask, why deploy location services at all? I mean, the core objective here is to deliver the right resource to the right person in the right location at the right time. And so when you think about it in those terms, if you take all the technology and peel it away at its core, this is really a process improvement conversation. This is about automating processes. And one of the ways that you automate processes is you reduce steps. You reduce steps in a process, but not only do you reduce the steps in a process, but you actually reduce physical steps as well. How long does it take me to find a piece of equipment? How far do I have to go to get it? Part of that process is the actual physical labor that's involved, the time spent, the human error. So all of this is around not only improving the experience for you as a consumer of RTLS technology, but for you to convey that to your end user, the patient, to improve the patient experience. So no matter what, technology should focus on facilitating solutions. And even though Centrak is an engineering company at its core, We are very much focused on solutions, on how we drive solutions to improve process within healthcare to help you with your primary mission of healing patients and saving lives. And this starts with everything from hand hygiene compliant, preventing HAIs, infection and prevention improvement or management, keeping patients safe by automating such things as environmental monitoring for monitoring vaccines and medications, protecting visitors and staff with staff arrest solutions by understanding where patients and staff are located in time and space, protecting patients and infants with infant protection solutions. Also, preventing dangerous misuse of devices by tracking and managing the cleaning of surgical trays, endoscopes, et cetera, and always making sure that equipment is available for use and that people know where it is in time and space for sure. Philosophically, we look at location as a utility. A lot like GPS location, we sort of take it, for granted the ubiquitous nature of location information in our lives today. And really the primary goal of location information is to match a service with a need based on proximity. So this is all about matching a service with a need, and in many cases, especially within healthcare, the ability to measure an interaction between entities, which really are how we measure phases of care, for example, and with location providing context for that interaction between two entities, a nurse and a patient, or a physician and a nurse and a patient, and maybe a piece of equipment as well. So our focus is on the development of the visibility infrastructure. It's all about really focusing on the unique environments of healthcare. But at the end of the day, what we're really trying to do is provide this location information as a consumable, basically, as a utility, so that it can be consumed and automate and in RTLS and location enable all sorts of applications and all sorts of processes. The key component of this, obviously, is the ability to locate accurately in clinically relevant spaces. So that could be a floor, a zone, a room, a bay, or even a chair level. And there really isn't any one technology that can meet all of the strict requirements. And so one of the unique aspects of the Centrak approach is the ability to combine a unique combination of technologies that include active UHF, Wi-Fi, Gen 2 IR, BLE, ultrasound, low frequency. This is what we call multi-mode technology. All these technologies have different strengths and weaknesses, and they can be applied in combination to address a variety of very sophisticated use cases that we see in healthcare today. So as this technology has been evolving over the course of the last couple of years, we're beginning to see more and more sophisticated understanding and sophisticated deployment of use cases in the healthcare space requiring what we would consider to be clinical grade locating. One of the things I would want to say about this as well, specific to Centrak, I think it's one of the things that interests me the most about working here, is the fact that our founders are very sensitive to our name in particular, who is a PhD electrical engineer, very sensitive to disruptive technologies coming into the marketplace. And so one of the things that I think that he's particularly good at doing is looking at a disruptive technology and deciding whether that technology has efficacy within healthcare, if it's something that we can integrate into our platform, or if it's something that we should mitigate and maybe not pay attention to. So one of the reasons you see so many different technologies at play here in combination is just the ability to look at what we would consider a disruptive technology. For example, BLE coming into this marketplace right now. We are absolutely integrating BLE into our platform because we see the efficacy in many cases of being a BLE-enabled platform in combination with some of the other technologies that we use, including our core technology, which is infrared. So you may ask, Steve, how do we get there? RTLS can be expensive and time-consuming to deploy. And so we have a fairly simple location adoption model that we're uniquely in a position to deploy because of the fact that we have so many different potential location technologies that we can bring to bear. So at the very bottom, we were talking about presence detection and potentially zonal level locating, which is basically, are you there? Where are you? Where are you within a zone? And it's very simple for us to deploy using Wi-Fi technology at that level, and then to build upon that. So the pyramid starts with a very broad base, which is very general locating technology like Wi-Fi, for example. As you move up the pyramid, we get into what we call limited certainty. And this is where we start to deploy battery operated devices such as infrared devices, potentially LF devices, in some cases ultrasonic devices. It depends on what we're trying to accomplish. We can bring Bluetooth into the picture here, but there are lots of ways for us to begin to build into a more sophisticated use case, such as for asset securities and asset in general, par level management, asset tracking, inventory management, capacity management for assets. So as we move up the pyramid, we become more focused in our locating capability. And once we get to the clinical grade locating, where we talk about room level, sub-room level, potentially chair level, and application specific locating, this is where we really gain traction with our location as a consumable model, because that's a point where there are about 140 plus integrated solutions that we can work with, that we can actually location enable the technology to automate processes, et cetera, everything from hand hygiene to perioperative workflow, staff locating, rounding, ED workflow. Again, this is a broader conversation that speaks to process improvement. How do we take this location information? We marry it with the various and sundry applications out there, some of which you may already own, to drive an improvement in process and ultimately improve care delivery to the end user patient. So adoption is driven by innovation. And so to the extent that we can deploy more sophisticated use cases, really requires an ability to innovate. And that's something that we've proven over the course of the history of the company, is the ability to really innovate and to drive not only this top layer relative to the various locating technologies, but all of the things that come from that, which include our ability to deploy battery operated devices to really reduce the size of our tags and develop a number of really efficacious form factors for tags. So when we go to the second page here, we look at the actual tag form factors and sensors, and you look at the variety of tags that we can deploy, everything from a multi-mode tag for Wi-Fi locating to a micro asset tag, which is as small as a quarter, to the ability to deploy 31-day patient locating tags that a patient wears on their wrist that are very small and are used for a number of very sophisticated patient and staff workflow use cases throughout the hospital, including ED workflows, et cetera. Staff badges that are not only functional from a button press perspective, but ergonomically designed to fit behind the staff's ID badges, et cetera. We're integrating more and more technology into the staff badge to include in the future HID, access control capabilities, et cetera. So the innovation and technology continues to go on.
I hate to interrupt you. This is Jamie with Webinar Wednesday. We have reached the 10-minute mark, which we've allotted for each panelist. We can wrap up a little bit later with additional information if needed, but I'm going to go ahead and hand control of the presentation over to Stephanie Andersen from ZulaFly.
Excellent.
And
excellent.
Stephanie, you should be able to see the prompt to share your screen at this point. Great, Stephanie. You're ready to begin. Stephanie, I'm afraid your line might be muted on your end.
It was. I apologize for that.
Okay. Let's start back over.
So my name is Stephanie Andersen, and I am the managing partner here with ZulaFly. A bit of background on ZulaFly and also our experience within the RTLS space. So we have been in the RTLS space right around 10 years, primarily focused on healthcare, so everywhere from different sizes of acute facilities to standalone clinics to senior care facilities. One of our core focuses is on our partner ecosystem and the relationships that we focus on within the healthcare sector. And as Steve alluded, this panel is a great example of that. We work with all of the other panelists in different capacities, whether it be from a hardware vendor relationship or from a go-to-market strategy and resellers of our software that are the distributor providing support and implementation and professional services around that. So we really do work closely with our partners to deliver a full working solution back to our customers, ensuring that we've all collectively covered the bases that the customer has requested. One of the pieces too that's key for us, we designed and developed our own platform, rules engine, and then also our user interface and mobile app. What was important to us was to develop a platform that could scale. So we've chosen specifically to use a Mongo database so that not only can we scale to large facilities and enterprise solutions, but so that we make it really easy for all of our customers to get access to the data that they need. Also, the UI was important for us, that it provides a good, easy user experience. It's self-explanatory where to go for what, but that it also looks very seamless as every customer continues to add on applications. And then I'll give some examples too of the rules engine and the mobile app as we move through. So this slide specifically talks about our middleware solution. And one of the keys to this is that we utilize RESTful APIs. We use that not only for our integrations with other solutions, whether it be, Nurse Call or a BI tool, but also allowing IT facilities to get access to all of the data that they need very easily and quickly. The rules engine, I highlighted that a little bit, and I want to just give a couple of examples. We have developed a rules engine that can handle the most robust requests of notifying staff, doing things on, a room board, maybe changing colors, to also something very simple that an administrator within a facility is very comfortable sitting down and creating a new rule as they need that. So not only can you use the APIs to pull the data that you need, but you can also use any of the canned reports that we have that are real-time and historical within our report center. Two other pieces I want to highlight. The workflow engine. Not only is the workflow engine available for patient workflow, but you can also set up a workflow on staff or assets. So maybe you would like to understand, as certain assets are moving through the sterilization process, how long are they sitting in each of those milestones, and do they maybe need to be sterilized again before they're used because they spent too much time in one of them? And then notifications. We do provide the ability to set up unlimited number of notifications, also with unlimited escalations. And that really is to ensure that staff are notified of the events that are important, and we make sure that somebody is responding to all of those events. So why ZulaFly? We talk about, the core applications that we offer around asset management, environmental or temperature monitoring, staff safety, but then also patient workflow and patient and resident locating. This just highlights some of the key aspects of our solution. So access to all of the data, that's key. We will work with all of our customers to make sure that the information we collect is exactly what they're looking for when they go to run reports or pull data into a BI tool. We've also created a dashboard theme within our user interface. So the ability to mix and match widgets eliminates a lot of the extra clicking around, but you also within each dashboard can print or export any of the information that you have quickly filtered to find. We're also hardware agnostic, and the ability to pull in data, multiple data from different sources. So it's important for us that each customer is able to utilize the hardware and the technology that makes sense for them to accomplish the use cases that they need to. So we have the ability to work with multiple vendors and pull that information into a single customer implementation. We also utilize the latest technology for our software and our platform for a lot of reasons. Not only does it allow us to scale easily and quickly, but it allows us to add new features and functionality much easier, as well as our customers put in those requests. The other piece too I'll touch on is our mobile app. So as staff are walking around and they're busy and they're looking for someone or something, they can quickly pull up the mobile app and not only do a search, but if they're looking for a pump in particular, they can see exactly if it's available for me to go get it and how long it's been in a particular location. So we've talked about some of the core applications that we offer. This talks about the flexibility of our platform. And this by no means is all-encompassing. This just gives some examples and some ideas of different integrations that we do. Integrations can be one-way, two-way, depending on what makes sense and what's asked for by the customer. But the flexibility is there to truly bring in data from any system so that the core information can be identified in a single platform. So not only for reports, for viewing, but also when you go to pull data out, thinking about location services as a whole, you can also have a single integration then that pulls any data that's needed directly out of our platform into, a data warehouse or a service bus. So a couple that I want to highlight on here, we can integrate with the nurse call systems, provide the pull cord view on the same map as we see with staff and patients or residents, which also then gives us the ability to have those reports within our report center. So without leaving, you can run reports on response times, not only to patient or resident call for help, but the nurse call in particular. CMMS, the obvious value add for CMMS is to know where your equipment is, where preventative maintenance dates come up and are due. But by utilizing our rules engine, if there is a pump, for example, that has moved into a patient room that is past the PM date, we can immediately notify staff that pump 123 has walked into patient room 200 and the pump is past the PM date. So not only in a couple of seconds do staff know exactly where they need to be, but they know what the issue is, which is a pump is past the PM date and it's now in a patient room. Integrating with EMR systems, every customer gets to choose which fields are important to them. What data metrics do they want to bring in from the EMR? And then the next 5 slides, I group a little bit and talk about that's where we think hardware, technology, again, these are just examples. There's others that we work with as well, but it makes no difference to us. And so if there are multiple form factors and multiple hardware technologies that fit the use cases for a single facility, we have that ability to bring in location data from multiple hardware technologies to a single customer. So it does not necessarily have to be a one-size-fits-all. BI then we've touched on. Utilize the data, bring it into a BI tool, slice and dice, see what you need to, and then of course the Active Directory integration. We can also set up permission profiles manually as well. So what makes ZulaFly different than other software solutions that are on the market? These would be the core 6 that I will always speak to. We do not have a concept of hard coding fields or field values. So we work with our partners to complete a template that highlights the columns and the fields that are important to the customer with their verbiage. We take then that information and that creates and configures their system. So they see exactly what they would expect. There aren't fields that are left empty, and there aren't fields that staff are wondering, what does that even mean? So we work with the customers, and that flexibility is absolutely there for them to customize it from the ground up. All of our applications, asset, temp, patient workflow, etc., are all applications within a single user interface. So if we have a customer that may want to just start with asset, and next year add on temperature, the look and feel is exactly the same, and we easily can add on any of those applications as they grow. We talked about the third bullet, which is the ability to bring in data from multiple hardware vendors to a single customer. We also, although we spend a majority or almost all of our time in healthcare, we do have a non-industry specific application. So that allows us to apply the same use cases, finding equipment or staff safety, in any other industries that fits as well. So it makes it a nice, easy transition. And because we are able to customize the system, it's very easy. Customizable dashboard views. Clinic A may not want to see the same dashboard as Clinic B, and they don't have to. Nor do all of the users have to have the same views. So it's important that every user gets to customize their dashboard, eliminates again the clicking around, but especially when you get into large health systems and have different units or departments, they customize their dashboards to fit what they are looking for and what's important to them. And then the last.
This is Jamie with Webinar Wednesday. I apologize for interrupting, but we're over the 10-minute mark, and I need to move to Mark from Infinite Leap. Mark, you should now see a prompt on your screen asking if you want to show or share.
Okay, can you hear me okay?
Mark, I can hear you perfectly. You can begin when you're ready.
Okay, and you can see my screen as RTLS Roundtable. Want to confirm?
Yes.
Okay, great. Well, thank you, and thank you to my colleagues, all of which we've worked with many times over the last several years. I'm Mark Rheault. I'm the founder and CEO of Infinite Leap, and I've been doing this, the RTLS and healthcare type of thing for since 2005. So a lot of these folks that are on the line, we've been working with for many years. Our role in this industry is we have established ourselves as the premier healthcare consultant and systems integrator for RTLS and all the related technologies. There's all the real-time technologies, location services, those type of things, as well as anything where you can automate healthcare. We've really looked at all these technologies and how do we make healthcare more efficient, safe, make sure that all the regulatory requirements are being met, all those type of things that a hospital must do to make sure that that can be efficient in this day and age. We started from a very a small set of things that we did, consulting and trying to get folks up and going, but we really expanded now. Today we have a full suite from planning and design to implementation of all the software and hardware that we recommend, to also the support of those systems, as well as ongoing customizations, custom app development, analytics, reports, really the end-to-end gamut of services you can imagine, and also many solutions out there too where we can package those up and make it very efficient and effective to get those implemented quickly. Our company is focused 100% on healthcare. We don't try to enter into any other spaces. We know healthcare inside and out. We have a team of nurses and operational efficiency experts, technologists, and everybody that we work with is always focused on healthcare. And so this is really a deep level of knowledge that we've focused in this area. We've implemented hundreds of RTLS projects at many clients now. And we've also provided not only just those individual services, but we actually provide it as a comprehensive set of managed services. So for some of our clients, we are their entire department. And so we actually manage it from top to bottom as a department within that organization. So whether some of our clients just want to have a single little project, or if it's run an entire program, we can handle all of those things. One of our clients out at Vidant Medical Center had a good quote that we'd like to share here. Plan before you jump into RTLS projects. It's not so difficult to implement RTLS for asset location. However, you need to look beyond asset tracking at the very beginning of your RTLS journey. Leverage expert advice to help you design the journey and future-proof it. And this is really what we are here for. When I first came into the industry, and I was on the software vendor side in my first company that I founded in this space, there was no service providers that really understood how do you leverage these technologies, how do you implement effectively, how do you support them effectively, how many resources does it take, what's it really cost to do this. And so there was a lot of wreckage in the industry, is the way we'd like to describe it, and that's really where we've come in to try to help with those type of deployments. Help with that planning, the design, the implementation, making sure it's, reducing that risk, because we've developed methodologies and processes on how to do this right. How do you calculate ROI? How do you gain executive support and keep them informed? All of those pieces that it takes to, not just to implement the technology, but to actually make it an effective program long term. So we help our clients with that whole journey from start to finish. One of the things we do, in addition to supporting over 100 use cases, we start off oftentimes by looking at what are the strategic objectives of that organization. And a lot of these categories, the strategies fall into these 6 categories of quality and safety, access and throughput, optimize labor and productivity, optimize supply chain and resources, patient engagement and experience, and staff engagement and experience. And out of all those different areas throughout the entire hospital, there are that 100+ use cases are scattered across all of those categories. So we touch almost every part of that hospital or clinic or senior care facility in some cases. So that's really the power of these technologies, is to how can you leverage it to its maximum capabilities. And that's really where we step in, and we look at all the different ways that a hospital could leverage these. And we come up with a strategic plan, we come up with a roadmap, and help them implement that. This is just a quick overview of how we usually do get started, just because, and I'll touch on a couple of our clients in just a moment. But really the key is getting that planning, as Neil Patel at Vidant had mentioned, is getting that planning done correctly up front. And so one of the things we've developed is a solution design process that is really how we kick off almost every one of our engagements. Before you even sign off on a big, whatever that budget might be, that, for a long-term project, we're really trying to help create a plan where we've identified all the document all the wants, needs, and opportunities. We go and talk to probably 30 to 40 different people within the hospital, typically a lot of the executives, team leads, department managers, and some of the frontline staff, to really understand what are the challenges and issues and what are the key objectives and desires within that organization. Then we take all those potential use cases and we prioritize those. We look at where should they be deployed, which departments have the biggest needs, what are the most important use cases, where's the biggest bang for the buck, and we help with that prioritization. And then from that, we go and create a detailed business model, including the budgetary costs, the value estimates, what is the value that we expect to be generated. And we do this on typically a 5-year basis. So each year is a phase, and what is the cost for that phase, and what's the value generated from that phase. And so it really gives a stage gate approach to incrementally adding on to that into the program over time. This is not just a implement and be done with it. This is much like an EMR implementation, where you have a multi-year plan and you don't necessarily do everything on year 1, but you have a plan on how you're going to leverage that over time, and you just incrementally add on to the system. And that's the best way that we found that this works. So with that multi-year deployment model, we also tie in the project governance and operational models. How are you going to run this effectively? Priorities are going to change, new requests are going to come in. How do you manage that? How do you brand the program? How do you communicate this program and gain mind share and gain support for it? How do you communicate what the potential capabilities are and generate awareness? Those are things that we incorporate into our program management. We also always start off with a baseline of the performance. So where are we starting from? And what are the metrics we're going to be tracking? What are the KPIs? And what are the goals that we want to set? And how do we measure against those goals? And when are we going to hit those goals? And then we can see what the success of the program. So if you don't know where you're going to, where you're trying to end up, you don't know when you get there. So really we're trying to define what are those goals right up front. Then we also look at the technical requirements, and along with that, which are the right products and the vendors to support that. We've worked with nearly everybody in the industry, and from very, very small to very, very large, and we know the ins and outs of every technology and every vendor out there. And the ones on this call are some of the best I can attest to. We've been working with on many projects over the years, and so. These are the types of things we bring to the table in terms of, as there's emerging technologies and new products or new categories, and new innovations, how does that tie into the strategy? How does it tie into your existing investments? You know, whether it's EHR or CMMS or any of those other systems that you've already bought, how do they consume and leverage real-time location services? And lastly, the delivery of executive level presentations. We help whoever the champion is in that organization, we help you through coaching and creation of the slide deck and how to communicate that and present that so that you know, when it goes to move forward with the whole program, you have everything you need, and it's concise and it's clear and it's understandable, and you can gain the support you need from the executive leadership team. Just a couple of our clients that we just mentioned here. Wake Forest is the premier implementation in terms of the most comprehensive use cases. It's been going since 2011, and it did start with that program I just mentioned, the solution design. It is exactly how this program, now in its 7th year and going in, they just extended the program and signed off for another 5 years on this. This is something that they've been a leader in, an innovation leader right from the very start. And so this is now a very widespread implementation at this academic medical center in North Carolina. It has about 1,500 beds, and now it has, it'll very soon have every inpatient tagged, as well as it has many departments with outpatients tagged, but you know, 15,000 or 16,000 plus assets now, over 1,000 temperature monitors actually has been implemented. There's over 30,000 devices deployed in this facility. And a few years back, we actually had an audit, a financial audit, and there's already over 10 million in savings based off of this program. So with that, you know, this is just one of those great examples. If anybody ever wants to have a site visit there, you're absolutely welcome to. You can reach out, but they do welcome site visits. And it's great to see this firsthand, to see about 50 use cases deployed using these technologies. It really brings it to home what you can do with these. And
great, Mark. I appreciate that so much. We're going to move on to Sandra from Sonitor now. Sandra, you should be able to see the prompt on your screen. Oh, that's okay. There we go. I can see it now. Your line's unmuted. You can begin when you're ready.
Great. Well, thank you very much. Thank you, Tech Nation, for giving us this opportunity to participate. Really are excited about being part of this roundtable. So as was earlier introduced, my name is Sandra Rasmussen. I'm the Senior Vice President of Sales and Marketing for Sonitor, and we're really excited to be participating in this event with all of you. Just a little brief introduction to Sonitor for those of you who may not be familiar with us. Sonitor has been focused on optimizing and delivering ultrasound-based RTLS technology for over 20 years. And our focus really has always been and continues to be on leveraging many of the unique and properties of ultrasound so that we can deliver the most accurate location data to support your facility and your use cases. We recognize that there's a lot of technologies out there for doing locationing activities, and many of those have their place in use cases and in markets, and we take full advantage of those for many of those applications. But our main area of focus really is on ultrasound and ensuring that what we deliver out into the marketplace does provide the highest level of accuracy for some of the more complex either use cases or complex environments. I think it was Steve that talked earlier about sort of specific application areas and benefits that RTLS can deliver to healthcare facilities. So I won't dwell on this, but certainly we recognize that there is a lot of value in deploying automated solutions that can deliver specific efficiencies and benefits both to patients, caregivers, and ultimately the healthcare facility in and of itself. So as we think about the audience and the target individuals that we're talking to on this webinar, we really understand what some of the challenges are, and we understand that the responsibility for RTLS often falls on the biomed team, the IT team, the clinical engineers. And we recognize that you need something that allows you to do your job successfully and efficiently. So when we think about how our technology helps you to succeed, we really think about that by focusing on 4 premises of Sonitor's RTLS. That's to make sure that we're delivering the most accurate and reliable indoor positioning data so that you're not questioning the location of something, you're not wasting your time, and you're trusting your analytics. We want to ensure you have a flexible platform that's scalable and easy for you to deploy and maintain and support. We recognize that cost is always a concern and that biomed teams often focus on identifying ways to help both reduce and improve cost efficiencies. And we also want to make sure that you've got a platform that gives you runway. So we're continuously looking at how to be innovative with the solution that we come to bear. So how's Sonitor's platform designed to help you achieve these goals? Well, as I said, we're based predominantly on ultrasound as our core positioning technology, but we combine a number of technologies to make sure that we deliver the best positioning and best communication capabilities for your facility, leveraging ultrasound as the core, making sure that we're leveraging your data grade Wi-Fi to make sure that the communication of the location is getting to you as quickly and as efficiently as possible and with no excess burden on your Wi-Fi infrastructure. So why ultrasound? There are some key properties associated with ultrasound that help deliver on the accuracy and the reliability. Ultrasound obviously is a sound-based technology. One of the key properties of sound is that it stays contained within a space by walls and windows so that you don't get location information jumping or hopping from one location to another. It stays contained within the location in which it's being, the signal is being delivered. There's no interference risks that are associated with either lighting and does not require line of sight. And because our technology is wireless and has the ability to be configured to deliver virtual walls and multiple zones using a single location transmitter, the system is easily scalable and adaptable as your facility and use case changes occur. So there's a lot of technology out there for doing locationing and positioning, and they all have their place in the market. But what we recognize is that from an ultrasound standpoint, if you're looking for really accurate and clear location information, that ultrasound really is the technology that delivers the best solution. Bluetooth Low Energy, BLE, has its place in the market. It gives you location proximity, as does technologies such as radio frequency. It'll give you good proximity, but if you're looking for specific accuracy, we have found that the best technology to deliver that is ultrasound, and we continue to innovate and improve on that to ensure that the performance over both use cases and over innovation continues to deliver the highest level of accuracy. I also mentioned that one of our key premises and how we help you be successful is to ensure that our platform is flexible, scalable, and easy to deploy. Our systems are battery powered. They can be PoE optional. They're driven by 4 standard alkaline D-cell batteries, so also environmentally friendly, and a single LT can create up to 4 zones. So that really gives you the flexibility to design your ultrasound accurate location needs by using the minimal amount of infrastructure devices while still being able to get very specific, accurate, reliable location information. We know it needs to be easy to deploy, so we provide tools that allow you to easily monitor the health and the performance of your RTLS deployment from Sonitor. And we provide, through our SenseView platform, dashboards that let you easily and quickly see the performance and health of whether that be your location transmitters and your tags as well. The other key premise I talked about is the low cost of total ownership. And again, we recognize that that's an important component to think about as you're thinking about an RTLS deployment. One of the things I mentioned is that our technology, our devices are battery powered, and that a single device can provide up to 4 zones. So what I'm showing in this demonstration here on the slide is how you can use 3 location transmitters to easily and accurately create 4 bays. And these 4 bays, again, powered by 3 location transmitters, only require 4 D-cell batteries in each of them. If you compare that to other technologies that require more devices and are powered by lithium batteries, you can appreciate that over the long-term cost of your deployment, there are significant savings as a result of the ability to use minimal devices and to have those powered by standard D-cell batteries. The last component I want to talk about is innovation, because we recognize that healthcare continues to evolve and grow and requires innovation. And therefore, as we look to technology platforms and new solutions that can provide healthcare to be more successful and deliver higher quality patient care, we've continued to evolve our technology, and our latest introduction is Forkbeard. That is a technology that allows us to essentially turn mobile devices into location tags, if you will. So it helps us bring GPS indoors and is compatible with the billions of mobile devices, phones, and tablets out on the market. So with that, I'd like to thank TechNation for their time. And again, just want to summarize by saying that we recognize some of the challenges that healthcare facilities and biomeds have in front of them in terms of supporting RTLS, and we do believe that by how we've designed, deployed, and continue to innovate on our platform, that we've got great solutions to help those facilities and biomed teams successfully and efficiently do their jobs. So thank you for your time.
Great. Thank you so much, Sandra. We have got quite a few questions that have come in. So, Steve from Centrak, if I can start with you, please. We have a question. Our infection control department has become more involved in the reprocessing of equipment. How do you clean and redistribute RTLS tags?
Oh, okay. So thank you for the question. You know, we have a lot of various and sundry tag form factors, and one of the advantages of our base technology, infrared technology, is the ability to fully seal and waterproof our tags. We have a number of other options, such as single-use tags, etc. Fully sealed tag allows us to, and allows the customer a number of options for disinfecting and sanitizing tags, because the tags are fully submersible and waterproof. And so they'll also withstand HLD processes that are used for medical scopes, et cetera. So from an infection control perspective, I think that we have a very friendly tag form factor for the various and sundry use cases that are available to us.
Okay, that's great, Steve. Now, Stephanie, we've got one for you. What makes ZulaFly different than other software solutions on the market?
Sure. So the last slide, I'll pick just 2 or 3 of the items that were on my last slide that spoke to the differentiators, and I'll start with the one that I talked too long and didn't get to, but we offer both a cloud-hosted implementation or on-site. And we do that because not everyone is comfortable with the cloud or is going to move to the cloud. And there also are large healthcare systems that have a data center. So we offer both. The customer can choose that the path that is right for them. The other differentiator that I'll highlight is that all of our applications are housed within a single UI, and the look and feel is very consistent across the board. And as we continue to add new features, it will have the same look and feel as the rest of the application, and easy enough to add additional applications as that system continues to grow.
Okay, that's great. Now, Mark, your turn. How do you develop a business case for RTLS that hospital executives can trust?
Okay, great question. So really it comes down to trying to think about what are the things that they're worried about, what are they concerned about, and what do they need to know to make a solid business decision on this is a long-term decision. I mean, you're really putting an infrastructure that you're planning to use in a wide variety of ways for many years. And so by looking at all the different use cases, again, just that long-term planning, what are all the different ways that this is going to be used? You know, not just talking to biomed, that is one good area where you're going to be focused on that, but also the clinicians, the executives, everybody, what are the needs before you even think about technology? This is more than anything, I would say this is not a technology first type of a place, even with all due respect to my colleagues on this. It really comes down to what problems are you trying to solve first and foremost, defining those, making sure you're really clear on what the objectives and goals are. And then from there, then you start crafting, what does that solution look like? What are the needs for the technology? And then you start aligning those technology needs with the vendors and the products in the marketplace. And so it's really starting with the end in mind, and then coming up with what I would consider, any other kind of business case for where you have a financials involved. You have to have, what is the ROI? What is it? Is this a compliance thing? Is it a safety thing? All of those kind of factors and benefits that are going to come into it, and just be able to proactively answer that and have a very crisp and clear answer. And so just like any other project where you have to meet some sort of a guideline in terms of, is this a 3-year payback, a 5-year payback, a 2-year, and how is this going to be used long term? You have to be able to answer that with this very crisply and cleanly.
Great, thank you. Sandra, what hospital staff received tags first during initial deployment? Were there any objections, and if so, how did you overcome them?
So oftentimes what we hear from, I will say, the non-clinical staff is that there is a concern that staff will push back because they don't like the idea of being tracked. And what we have found is in delivering a solution such as RTLS, it's really important that the clinical staff be part of the discussion around the value of deploying an RTLS solution and really what's in it for them. So the discussion that we've helped our customers and users have with their clinical staff is that it's not about wanting to track the staff, but it's really about providing them with a solution that allows them to be more effective, do their job, gather insights around some of the challenges that they're having in their jobs, what are the roadblocks, and how can automation and analytics as a result of that automation give the right insights to put in place process improvements so that they can do their jobs better. The tags and the badges themselves are light. The form factors they're not cumbersome when it comes to wearing on garments such as clinical scrubs or lab coats or anything like that. So what we found really is it's really about how it's communicated to the staff and how the value that it brings to them is both described and then communicated across the whole facility.
Okay, that's fantastic. Thank you. And back to you, Steve. How do you manage device health battery life and replacement?
Okay, well, that's a really, really important part of the long-term care and maintenance of deployment. And what we do is we have a middleware platform called Connect Plus, which allows us visibility to all of the devices and tags that are deployed within our RTLS ecosystem. So not only are we able to assess the general health of the system, we can proactively predict the battery life of devices and tags. We can allow that to drive coordination of battery changes with preventive maintenance on equipment, et cetera. It's a very comprehensive platform that allows us to manage the battery life as well as to manage the overall health of the system very well. And it puts us in a position to drive prolonged battery life within the tags themselves. The average battery life for an asset tag, for example, even a mini asset tag, is around 5 years. And we can monitor and predict that with a great degree of accuracy. We've got a lot of experience in managing infrastructure, battery-powered infrastructure over the course of the 12-year history of the company. So there you go.
Okay, and Stephanie, does ZulaFly offer a cloud-hosted solution?
We do, absolutely. We offer both cloud-hosted and on-premise.
Great, thank you. And now, Mark, what type of data is helpful to collect to provide an ROI for an RTLS system?
All right, great question. You know, it really depends on the use case. For assets, you know, I think everybody knows you need to know what your fleet size is, what's your quantities, what's the value of that fleet. You know, then you take and benchmark. Once you put in RTLS, you benchmark what is your current utilization and compare that to your target. You establish par levels, and then you start managing towards that. That's really kind of the normal stuff you'd expect with an asset management thing, is trying to reduce your rentals and your purchases and your preventive maintenance. But when you get to like a patient flow, really a lot of what you're trying to do is, are you maximizing the time that you're spending with providers? So that patient contact time with providers, and you're looking at volumes. Are you getting more patients through? Are you turning over faster? So all that value add, all that non-value add time where staff are not spending time with patients, or the patients are waiting long times, those are the things that we're really key in on. And then you benchmark that, and you put the process changes in place, and then you monitor and measure and keep tweaking until you get to the goals that you're looking for. Really changes, it depends on all the different use cases, and every one of them has different factors that we look at.
That's great. And Sandra, one more question. How have hospital staff adjusted to having RTLS? Do they see the benefits?
I think one of the biggest benefits that caregivers see is appreciating how RTLS provides them with a level of safety. We've had many caregivers reach out directly to us and talk to us about how having had an RTLS badge has given them the opportunity to call for help or assistance in difficult situations where they either have felt threatened or have had a difficult patient. So the value, again, and the benefit that is being communicated to us on a regular basis is this value that they get, feeling a sense of safety and security, and have often commented that they can't see themselves having performed their jobs without it in the past. And they feel that it allows them not just to have that sense of security, but also gives them an opportunity, therefore, to give a better and higher quality level of care to their patients, because they're also feeling more confident in their ability to serve those patients in a safe environment.
That's great. Thank you, Sandra. We have come now to nearly the end of the hour, so any questions we didn't get time for, I will be sending to the presenters offline, so they will reply to you directly. I'd like to thank Steve, Stephanie, Mark and Sandra for a great webinar, and again, thank you to today's sponsors, Centrak, ZulaFly, Infinite Leap, and Sonitor. One lucky attendee will win an Amazon gift card for completing the post-webinar survey, which will appear on your screen shortly. You must complete the survey to obtain your certificate of attendance. If you don't see the survey, please email us at webinar@mdpublishing.com. For more information about our upcoming webinars, please visit our website, webinarwednesday.live. I'd also like just a quick reminder that all of our webinars are available to view on our website. They are now fully automated to allow you to view, complete a survey, and download a certificate. So it's a quick and simple way to gain more CE credits. So once again, thank you all for spending the afternoon with us. Have a good rest of the day, and we hope to see you next time.